Hi, I'm Dr. Azarani, and together with my husband, Dr. Ayari, who's a board certified geriatrician, we have a geriatric clinic in the Bay Area, California. Today, I want to address a very important question often asked by our patients, and that is when do I need a care manager or I need to hire a care manager for my family members? And where can you find them and what is really their roles. Now, imagine that you're an elderly person or a senior living at home and you're starting to have difficulties running the household, or for whatever reason you cannot drive anymore. At this point, you start interviewing care managers. So, first go to your board certified geriatricians and ask them for a list of reference of care managers they trust, because geriatricians work with these care managers day in and day out. And then start interviewing them. And what you're expecting them to help you with are the followings. You can call them and ask for somebody to drive you to all your appointments, including your doctor appointments, dental appointments, and hospital visits. You can ask them to manage all your medications because you have many medications. Somebody needs to go pick them up from pharmacy, bring them, place them in your pill box. You can also ask them to bring the infrastructure to run your household. That could be cleaning your house, it could be gardening, it could be that somebody can stay with you 24/7 and basically keep an eye on you because you no longer want to stay alone at home. Uh, and they can also do many other things. But the most important thing they do is that they can be the line of communication between you and your board certified geriatrician, or between your family and your board certified geriatrician, as well as other physicians. And I'll give you an example. If, for example, you do not have your children around, they are in another state or another country, or your parents are elderly and they don't have any family in the area. They could be at home, they could be in an assisted living, or they can be in memory care unit. But because you're not there, you're always worried about whether all the infrastructure to make them feel safe, secure, is not around them. So you would hire a care manager to do all that for you with regard to your parents, or if you hire them for yourself, for you. So they can be a very good resource for helping you either maintain your life and your activities in the elderly stages of your life, or do that for your family members who are becoming elderly and need help. Now, in the state of California, care managers do not need any education or certification per se in this field to become a care manager. So, when you call these companies after getting your references for a care manager company from your board certified geriatrician, contact them. And normally, these companies have over 50, sometimes 200 care managers in different areas, in different states. You can interview a few, you can request a woman or a man, and you can ask for references to make sure that they have been background checked, and they have worked in the field for many years with the elderly, and they can be trustworthy and provide you the care that you need. And so don't be shy. If you're a family member hiring for your mom and dad or for yourself, interview a few of these companies, interview more than one care manager within the same company. Ask them how long they've been in the business. Ask them how they background check their care managers, how long they have worked in the industry and with how many families, and ask for a reference. Uh, Care managers can also help you find the right infrastructure for a lot of different medical needs. Like they have a lot of connections, for example, to different doctors, different specialists, specifically board certified geriatricians. And they can also help you if they see that your care is becoming very complex to direct you on where to go and what kind of doctor they trust and they have communicated with regard to their previous patients, and that could also be a valuable resource for you. The second thing that you have to keep an eye on is the cost. Some of these companies charge a lot of money for a care manager, and just because they're charging you a lot more, it does not translate into them providing a better care manager. So interview a few different companies, find the price that is right with you. Also find out how many other patients at the time they're managing, and make sure that they can be available when you need them and that you will have access to them 24/7. Some of them work in groups, so if they are not available during a holiday or after the hours, they can still give you a number to call the company, and somebody else within that group can help you. So I hope this helps, and I will send you, I'm sorry, I will see you during the next video.